And he looked up to me and said, do I have to know stuff before I can do stuff? And I said to him, that's it. That's one of the fundamental rules of life. Good for you.
Hey, what's up everyone? Thank you guys so much for joining us today on Talking to Other Things with Lunakye, where we explore the humanity within all of us. We welcome our very distinguished guest, Dr. Hamlin Emory, a neuropsychiatrist and medical doctor here in Los Angeles. He trained at University of Virginia, UCLA, and Harvard University, and was even a volunteer flight surgeon for a Marine Air Squad in Vietnam. We are so excited to have you here today, Dr. Emory.
Thank you.
How are you?
It's a pleasure. I'm quite happy despite my chronology.
What do you mean by that?
I feel very grateful for my adventures in life and still looking forward to the future.
Wonderful. Well, you know what? I think everyone can be inspired by that. My first question is, what human quality most notably connects all of us?
Well, I think if I'd have to qualify it, what connects us in the most sustaining way is our humanity and looking for the best in people and appreciating those qualities in others that you can admire.
Okay, so just to learn a little bit more about you, what sort of household did you grow up in? I mean, tell us a little about your life story. What was teenage Hamlin like before he was Dr. Emory?
I grew up in an idyllic household, and my parents loved each other, and they were quite community-oriented, and there was no argumentation or rancor. And I recall when my sister and I were in our teens, the television broke, and we just put it in the basement and kept reading. The message really was gain knowledge and make a contribution to reality, and you will make a contribution to yourself in the process.
And that's your core belief now?
Yeah.
That's amazing. That so much speaks to how important having a foundation is growing up.
Well, but you see people now and then who are structured that way. Yeah, it's an adventure to apply your abilities in a way, knowing that you're in a lifelong learning process. You never max out, you know.
What is the most, this is off the cuff, but what is the most prominent or notable thing that you have learned most recently?
I've tried to see if the technology that I use, which is EEG and quantitative EEG, I did some experiments to see if I could decrease the number of electrodes, which are approximately 20 electrodes on the scalp. If I could decrease it by 50% and still obtain some reasonable, pretty good data, and I was unable to do that. So I was trying to see if we could simplify the technology that I use and therefore maybe make it more available to people. But it's really so complex that you really have to use the standard EEG 1020 system, and it's going to require 20 electrodes on your scalp.
Okay, so I just moved my leg because I felt I needed to move. I felt, whatever you want to call it, not uncomfortable, but I felt like I needed to wiggle a little bit or whatever.
Okay.
I saw a video where you speak about that, and you talk about it being a homeostatic.
It's a homeostatic impulse, sure.
So we all do that, right?
Sure. I mean, why do you scratch? It's because you have an itch. If you want to delve into abnormal or pathologic behaviors, why do some females, mostly females, begin to pull out their hair? There's a reason why people will repetitively do something that seems odd or abnormal, that most people don't do. And a doctor's job is to determine the physiologic reason for it, rather than just presuming that it's a psychological reason.
Fascinating. And would you say that most doctors do not use that practice properly?
No, they don't. They don't have that attribution style. I can remember when I was lecturing on what they call trichotillomania. This was 2 decades ago, and I was lecturing about eating disorders as well. And a couple came up to me at the end of the lecture and said, "Dr. Emory, our daughter is a trichotillomaniac." And I said to them, "Don't call your daughter that. That's very dismissive. It's harmful, and it just shows the lack of scientific understanding about why she's doing it." People don't persistently adopt and participate in, we'll call it abnormal behavior, deviant or abnormal behavior, unless there's some utility in it for them. And the doctor's job is to figure out what that is and then go about correcting it. So I had to find a way to identify the physiology in the behavioral syndromes that we call mental and emotional disorders. And that's when I came upon a new technology in 1986. The EEG had become digitized as a result of computerization of the paper technology. We used to do EEGs on large reams of paper and with a stylus and an ink. It was very messy, and it wasn't as precise as what we have today.
I think I've seen that in films, maybe. I think I can picture what you're talking about.
That's right. The little spindly stainless steel arms with a point, and they would come out and, yes. Well, once I started looking at people's EEG signatures, I began to learn how to correlate particular quantitative EEG measurements with a medication or a naturopathic substance that would improve or correct some abnormal EEG, quantitative EEG measurements for the individual. Then my partner and I published our first paper in 1995 on 97 children, adolescents, and adults with mood disorders and attentional disorders. And we showed that people's improvement and overcoming, whether they had a major depressive episode or had a long chronic attentional problem, the results, the successful results, correlated with the person's EEG and quantitative EEG measurements. It did not quantify with the person's symptoms or behaviors. So since that was 1995, since that time, I've not used symptoms and behaviors as a basis for treatment of human beings. I record the symptoms and behaviors, but I use only physical findings.
Okay, well, this is a question that I have been curious to ask you for a long time.
What?
Have you struggled with mental health personally, and if so, how?
I haven't struggled with mental health issues, no, but I have done EEG, had EEGs done on myself, and over the years, as I've gained chronology, I have initially tried SAMe, which is a modified vitamin B6, and more recently put myself on atomoxetine, which is brand name is Strattera, and it is a noradrenaline upregulator, and it tunes up my alertness frequencies a little bit, and though I'm 3 months away from 80, I don't feel any different than I did when I was in my 60s.
That's amazing.
And I tend to keep it that way.
And do you attribute that to medicine?
Not medicine alone, no. I attribute that to my parents and my life experiences and my reading and my philosophy of life and my interests and all those things that connect me to reality.
So what do you know about the law of attraction, and what do you know about the law of attraction, and what is your interpretation as it relates to the human experience?
The law of attraction. Well, honestly, I must say I don't think I've ever read a treatise on the law of attraction.
So yeah, so sorry to cut you off, but I want to define the law of attraction and make sure we're on the same page.
All right, do it.
So the law of attraction to me is a metaphysical concept. It's the concept that the images and the thoughts that we create in our minds and the words that we speak out and the actions that we take become our reality, inevitably. So if you have a reoccurring thought that triggers an emotion or a sensation within your body, eventually you will manifest that into fruition in some way in your life. Not in a linear sense necessarily, not like you picture a sports car and then the sports car appears out of nowhere in front of you, but that you create good feelings within your body and it kind of puts you on a path and a flow of life that attracts to you what it is that you ultimately desire. And sometimes you maybe don't know what that is. And the scientific part of that is, and I can't speak to this fully, but I have read articles about quantum physics or about the law of attraction being rooted in science as it relates to quantum physics. Is that anything that you have ever heard of, or do you believe what I'm talking about?
I am open to your terms. I would have to just keep it simple and quote Jefferson on his phrase, life, liberty, and the pursuit of happiness.
So what would neuroscience say about my ability to speak more concisely and think more clearly when I'm exercising or after I've exercised, and as that applies to most people.
Right, most people who don't have a cryptogenic tachycardia, who don't have a hummingbird heart, if we're talking about normal, healthy people who have a normal heart cardiovascular circumstance, don't have, a hummingbird heart, boom, 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 boom. They don't feel better after they've worked out. I'm sure that those people have an undiagnosed cardiac condition that was never picked up, and it also probably was referable to brain activity. You feel better, as I do, after running for a long time, walking for a long time, or spending an hour lapping in the pool. The reason is that you're in the process of that, you've oxygenated your brain and body, and you've improved your physiology, your overall physiology. You've given it a frisson. So you've actually improved your whole bodily metabolism and cellular metabolism. You should feel better because you've increased your all the chemicals that are associated with euphoria.
Is it an increase of chemicals, or is it a balancing of chemicals, or both?
It's both.
Okay.
It's both.
So how does basic physiology, for example, heart rate and blood pressure, play a role or connect to determining an individual's mental health?
Respiratory rate and the normal daily functions of a person are essential essential data in assessing a human being to see whether you can help them with an illness, or in my case, in my work, to see if I can improve their cognition or sleep-wake cycle, or improve their ability to memorize information, to reverse digits, to reverse letters, etc., and do very detailed cognitive functions. Because what I discovered some years ago is that if I improve a person's cognition as well as their emotional state, but cognition is more important than emotionality, and if I aim treatment to optimize a person's cognitive efficiency, usually their basal emotional state will improve within that process. Is that a sufficient answer?
It's a very sufficient answer.
You have to know stuff before you can do stuff, right?
Right. Of course.
Who told me that? It was about an 8-year-old kid told me that one day in a psychotherapy session. It was about 40 years ago. And I do not know how the kid came up with that. It was a question. He looked at me, and he had been a terribly acting out boy and causing his parents all sorts of trouble. But after about 4 months or so, and he looked up to me and said, "Do I have to know stuff before I can do stuff?" And I said to him, "That's it. That's one of the fundamental rules of life. Good for you." And I took him back out to the parents. They came back the following week and said, "We don't know why, but he's very different. He's been just fine ever since." I said to them, "I have no idea either, but let's just leave that alone. Bring him back if it doesn't work out." I never saw them again. So now imagine a child that young putting something so succinct. It's a nice aphorism for life, isn't it?
Yeah. So just back to mental health. Are mental health issues more commonly caused from biological or pre-existing biological traits, or sorry, I'm having trouble saying this.
Or is it all phenotype psychology?
I have no idea what that means.
Is it, are mental health issues?
I was going to say, or is it
frequently
the environment in which the individual is brought up in? Is it more due to brain development at birth, or is it more commonly caused by environmental?
It's both, but what has been assumed since psychiatry has not really followed the medical model, and since even now neurologists don't, or have just started, they've just started using quantitative EEG. The fact is that looking at people's individual neurophysiology has not yet been fully exploited, if I can use the word in a nice sense. But it's coming, because I read 6 months ago that University of Texas is teaming with UCLA to do a big project on quantitative EEG. And I think it's inevitable that psychiatry will shift from this huge, thick DSM that has, I don't know, over 1,000 diagnoses.
What does DSM stand for?
Diagnostic and Statistical Manual of Mental Disorders.
Okay.
They're not separate disorders. They're nothing but descriptions. That's all. Someone who drinks excessively. Why? Well, if they do that excessively, most likely there is some ameliorative or improved state of mentation that they sense, or they wouldn't continue to do it. There has to be some payoff. There are people who have underlying rapid pulse rates, and they go to see a psychiatrist, and those pulse rates are not, a rapid pulse rate isn't identified, and they proceed with giving medicines that will slow the person's alertness frequencies. I find this often occurs in children who are hyperactive. Well, there are large subsets of people who, because they haven't been adequately examined, physically examined, and monitored. You have to monitor someone sometimes for 2 or 3 or 4 weeks to be sure that they have an enduring set of vital signs. And when you approach that therapeutically, what you want to do is to improve the person's automatic circuits. When you improve the automatic circuits, the voluntary circuits improve spontaneously as a result of improving the automatic circuits. I hope I live long enough to see the use of this across medical specialties, actually. I just read an article that says 63% of people who are treated for major depression become obese. Well, the reason for that is that most of the medications that psychiatrists just prescribe are medications that are safe. They want to be sure they don't prescribe something that is too excitatory, so they naturally turn to agents that reduce voltages in the alertness frequencies. These are the serotonergic upregulating agents. I'm not going to talk about specific medications, but these are the ones that doctors generally prescribe. They are serotonin SSRI, serotonin reuptake inhibitors. Over a few months or years, their metabolism can be excessively diminished, and they will become portly or obese, and remain so unless the doctor has the capacity to think about patient-centered medicine and realize, gee, this person is gained 40 pounds in the last 12 months. The idea of treating people holistically is only considered by a very small subset. I don't know what that is, but a small subset of medical doctors, including psychiatrists. Since the brain controls everything, we ought to give more intense scrutiny to each person's baseline neurophysiology. And it's not that difficult to learn. This is going to be a watershed year, or next year will be. We will see as a society less use of medications that reduce voltages in the alertness frequencies and make people portly. We're going to see that. It will be inevitable. And I think they will, if they look at people comprehensively, they will discover what I've known, and those people to whom I've lectured now know, and the practice and the standards in general medicine will improve. We should have been doing patient-centered medicine ever since the term evolved 20 years ago.
How much control do we have over our lives as human beings or our happiness? And does it vary from human to human?
Of course it varies from human to human. Anyone who is really introspective has control over their life.
Can anyone find happiness?
Provided someone is endowed with most brain mechanisms. Happiness is achievable, but it's a multivariate circumstance. And if you're born as a sociopath, I would question that a person like that is going to live a happy life. They may feel gratified, but I don't think those two terms are synonymous.
So is what you're saying just what life is? Are the cognitive abilities that we are born with as individuals and the diverse cognitive abilities, mm-hmm. Are they innately malfunctions, or does each individual just have different strengths and weaknesses, and they need to live their life and find what their strengths are that are going to help them accomplish what they need to in order to attain that happiness? Did I articulate that okay?
Yeah. I think that happiness is achievable for anyone who's not distorted. Anyone who has the ability or learns through education, either the ability through parental example or through education, can make a choice and choose to emphasize, I think, what are the values that he or she wants to develop and evolve in themselves, and would then following the birds of a feather flock together notion, would choose to then filter out people who don't have such programming. I do think it is a philosophical choice.
So if tomorrow is your last day on Earth, how do you think you'll be remembered?
I think I'll be annotated in the literature as a pioneer in a different methodology or different approach. The work that I've published is in Australia, it's in the European countries, the small subset of people who are involved in EEG and quantitative EEG know about this work, and including, the fact you can apply this to improving people with diabetes, improving people with epilepsy. Improving epileptic treatment is a big deal.
Last and most important question as it relates to talking to Earthlings. What does it mean to be human?
Well, you mean my answer to that?
Yes, yes, your answer to that.
Well, I think it means that you have a large data set, and your data set includes interactions with a plethora of people, including people of other races and other languages. It's sort of oxymoronic. I think you have to be sufficiently acquainted with persons whose language and cultural institutions or cultural habits are different, and be able to see the preciousness and the humanity in those differences and not feel threatened.
Okay, actually, I'm sorry, one more question, because I think it's really important, and then I'm going to let you go. We are currently in a pandemic. Our world is in a state of chaos, where many people are suffering mentally. What would you suggest people could do? What simple measures would you suggest people could take in order to optimize their mental health?
They need to be sufficiently disciplined to follow the guidelines, and if they possibly can, they need to spend some time each week rejuvenating their transport system, which is their body. We ought to have more emphasis on health and what not to eat, because I generally tell patients, don't eat anything that's advertised on television. It's simple. You keep yourself physically fit and mentally vital by exploring, on a lifelong basis, various parts of reality.
Well, Dr. Emory, I have to say thank you so much for being here. Thank you so much for being here.
I appreciate
you have
that.
No idea how much I look up to you.
Well, you're very kind.
You're the coolest 80-year-old I know. I'm sorry, 79.
Yeah,
79.
It's practically, you have to round it up, 8 decades. I don't feel it. I don't feel that. Rubber bands. Buy yourself a set of those rubber bands.
Okay.
You know, the green, red, black?
Yeah,
yellow?
I do, that you see at gyms?
Yes. It's a gymnasium in your pocket.
All right, well, I'll take that to heart.
Thank you. I hope you can edit it down to something that's entertaining and doesn't cause drowsiness.
We've created Talking to Earthlings to have raw and honest conversation with one another in an effort to unite human beings who may not agree ideologically, but who can be inspired by one another's vulnerabilities. By watching our show, you are helping us accomplish the goal of changing the world, one conversation at a time. Follow our socials to stay updated. Thanks.